Hi, and welcome to Among Therapists, Practical Tips by Psychotherapy Academy. I'm Dr. Jessica Díaz, and I am an editor at Psychotherapy Academy. I'm thrilled to have you here for another episode. In today's session, we'll explore crucial aspects of dialectical behavior therapy, or DBT, and the role of phone coaching in helping clients apply skills in real time. As therapists, we know the significance of providing support beyond the therapy room to reinforce skill application in everyday situations. That's how phone coaching helps us. Before we dive into today's session, I want to remind you about our exclusive membership, Therapy Pro, which includes clinical cases. Clinical Cases offers you a deep dive into case conceptualizations of complex conditions with expert clinicians, guiding you through strategies and frameworks from various therapeutic approaches like DBT, ACT, couples therapy, and more. As a member of Therapy Pro, you'll have access to a wealth of supporting materials, including practical worksheets and handouts that are perfect for enhancing your therapy sessions and boosting client progress. Plus, by participating in clinical cases, you'll not only advance your skills, but also earn valuable CE credits, taking your professional development to the next level. This episode gives you a sneak peek into clinical cases. Today, we'll explore the concept of phone coaching in DBT and how it can help clients like Lisa apply their skills in challenging moments. Our faculty member in this episode is Dr. Stephanie Vaughn. Dr. Stephanie Vaughn is a clinical psychologist and owner of Psyche, a boutique therapy practice in Nashville specializing in cognitive behavioral and dialectical behavioral therapy. She is an associate faculty member at Vanderbilt University and one of only 2 DBT Linehan board-certified clinicians in Tennessee, known for her expertise in treating therapy-interfering behaviors and high-risk adolescent behavior. So stay tuned as we uncover how phone coaching and the opposite action technique can empower clients to make meaningful behavioral changes in their lives. All right, so let's listen to Dr. Vaughn.
Six, patients must learn new behaviors in all relevant contexts. So they need to be able to do whatever it is that you're teaching them to do in skills group or whatever it is you're teaching them to do in individual. They need to be able to generalize that to other places, not just in the therapy office. Well, how will you know? How would you know that they were doing that? You wouldn't necessarily know. And the best way to help patients generalize things like that is to help them in the moment. But they're not having problems in the moment a lot of times. They're in your therapy office and it's nice and cushy, or they're at home and they're in their pajamas or whatever and they're just relaxed with their tea. So then how can you help them in the moment? That's what phone coaching is for. So it's a large part of why we do phone coaching, because it's so exciting. We catch them right in the moment that they're in, right then. And then we say, oh, this is great. This is a wonderful opportunity. Let's try using, for example, opposite action. So let's imagine that Lisa used her phone coaching, which we would have oriented her to. She would call or she would text. I prefer that they text, so she would say, is this a good time? And I would say yes, or I would say, give me, a few minutes or something. And then I'll call her and she would say, I think I'm going to go off on this, fill in the blank, what she calls her boyfriend. And so I say, oh, this is a wonderful opportunity for us to use skills. And then, of course, I'm sort of making a joke at the same time. I'm keeping it light. And she knows that I'm not put out, because I'm actually not put out, most likely at that point. And so I say, let's use opposite action. And opposite action is when you do the complete opposite of what your emotions tell you to do. So Lisa is angry. She wants to strike out. She wants to tell him everything that he's doing wrong and why he's lucky to have her, and maybe even tell him to get out. And whatever other kind of unskillful interpersonal behavior she might be engaged in. So she hasn't done that yet, which means we have that opportunity. And that reframe that I just did, where I said, oh, great, this is a wonderful opportunity, is what's called making lemonade out of lemons. That's what they call that in DBT, making lemonade out of lemons. So I would reframe, say, this is a great opportunity. Let's do opposite action. I imagine that you're feeling pretty pissed. Yes? Yes. And what is it that you want to do? I want to confront him. What is the opposite of confrontation? Well, it depends, right? If you're the kind of person who the opposite of confrontation is to retreat, to go away and center yourself, okay? Or are you the kind of person that the real opposite, the all the way opposite, would be doing something nice for someone? Imagine how difficult that would be when you are in the middle of a very, very strong urge to be ugly to somebody, and maybe you even just don't want to hold their hand, or you just want to pout. Then doing the opposite would be doing something nice. Very powerful skill, very difficult skill. So I would tell Lisa that. I would say, I'm just not really sure that you would be able to do this, but if you're desperate, I highly recommend this. And that usually gives people a little bit of motivation, because we've all got a little fire in us, I think, I think I could do that. Now, they usually will say, that's the last thing I want to do. And I say, no doubt, because that tells me it's an opposite action. No one ever wants to do an opposite action. By definition, no one wants to do an opposite action because it's the opposite of what you want to do. So then, what might Lisa do? Usually they can come up with things on their own. I have known people to give hugs. I mean, you got to know your audience kind of thing. But I've known people to give hugs. I've known people to say nice things. I've known people to make things, like cook something nice for someone. There are also ways to do it without doing it directly to that person. I had one recently that sat and wrote out all of the positive things about that person, everything that they were, grateful for, that they liked about that person. Very, very difficult to do both of those at the same time, to be angry and grateful at the same time. So these are incompatible together in full. You can't be 100% grateful and 100% angry at that person. So that's what we're doing when we do opposite action.
Okay, so that concludes our exploration of phone coaching and the opposite action technique in DBT. Let's recap the key points we discussed today. Phone coaching allows therapists to guide clients like Lisa in real time, helping them apply DBT skills during challenging moments. The opposite action technique encourages clients to act contrary to their emotional impulses, breaking the cycle of reactive behavior and promoting more effective responses. Practicing gratitude can counteract negative emotions like anger, helping clients maintain a balanced emotional state. Mindfulness exercises like box breathing can help clients center themselves and manage stress more effectively. Using thought records to challenge automatic negative thoughts can reduce self-criticism and increase self-compassion. Finally, self-soothing techniques such as taking a bath or listening to calming music provide clients with healthy ways to cope with overwhelming emotions. Remember, therapy aims to help clients live in accordance with their values, even amidst discomfort and challenges. Okay, so that's all for now. Thank you for joining us today as we explored the world of phone coaching and opposite action in DBT. Stay tuned for our upcoming episodes where we'll continue to provide practical psychotherapy tools to enhance your practice. If you're a mental health professional, clinical cases can be invaluable for your professional growth and development, with the added benefit of earning CE credits. To learn more about membership, accreditation, and clinical cases, you can find the link in the show notes. Your support is very important to us, so please consider leaving a review on Apple Podcasts and sharing our podcast with your colleagues and friends. We appreciate your dedication to helping clients build meaningful lives through committed action and self-compassion. This is Dr. Jessica Díaz signing off and wishing you continued success in your therapeutic journey, helping clients find their path to a more values-driven and fulfilling existence. Bye-bye.